Understanding blood cancer. An introduction. Blood cancer is a complex group of diseases. It affects the production and function of blood cells. These cancers originate in the bone marrow. This is where blood cells are formed. Blood cancers can spread to other parts of the body, including the lymph nodes, liver, and spleen. There are three main types of blood cancer. These are leukemia, lymphoma, and myeloma. Understanding these different types is crucial for effective diagnosis and treatment. Blood cancer disrupts the normal production of healthy blood cells. This leads to a range of health problems. It's important to learn about the symptoms and risk factors associated with blood cancer. Early detection and treatment are essential for improving outcomes. Delving deeper types of blood cancer. Blood cancer is a complex and multifaceted disease that affects the production and function of blood cells. There are three main types of blood cancer: leukemia, lymphoma, and myeloma. Each type originates in different parts of the blood and has unique characteristics and treatment approaches. Leukemia affects the white blood cells. These cells are crucial for the body's defense against infections and diseases. In leukemia, the bone marrow produces an excessive amount of abnormal white blood cells, which can crowd out normal cells and impair the immune system. These cells are an important part of the immune system. They help fight infections by attacking and destroying harmful bacteria, viruses, and other pathogens that invade the body. Lymphoma affects the lymphatic system. This system includes the lymph nodes, spleen, and other organs that produce and store cells that fight infection. Lymphoma occurs when lymphocytes, a type of white blood cell, grow uncontrollably. This system is part of the immune system. It plays a vital role in maintaining the body's fluid balance and defending against infections by filtering out harmful substances. It helps remove toxins and waste from the body. The lymphatic system also transports lymph, a fluid containing infection-fighting white blood cells throughout the body. Myeloma affects the plasma cells. These cells are a type of white blood cell that produces antibodies, which are essential for the immune response. These cells are a type of white blood cell that produces antibodies. Antibodies are proteins that specifically target and neutralize foreign invaders like bacteria and viruses. Antibodies are proteins that help fight infection. They recognize and bind to specific antigens on the surface of pathogens, marking them for destruction by other immune cells. Each type of blood cancer has its own subtypes. These subtypes are classified based on the specific characteristics of the cancer cells and their behavior. These subtypes have different characteristics and prognoses. Understanding the specific subtype is crucial for determining the most effective treatment plan and predicting the likely course of the disease. For instance, leukemia can be acute or chronic. Acute leukemia progresses rapidly and requires immediate treatment. Chronic leukemia develops slowly and may not need treatment right away. Lymphoma can be Hodgkin or non-Hodgkin lymphoma. Hodgkin lymphoma is characterized by the presence of Reed-Sternberg cells, while non-Hodgkin lymphoma includes a diverse group of blood cancers that affect the lymphatic system. These types differ in their cellular characteristics. The differences in cell types and behavior influence the treatment options and prognosis for patients with lymphoma. Myeloma typically affects the bone marrow and can lead to bone damage. This type of cancer disrupts the normal production of blood cells and can cause bone pain, fractures, and other serious complications. The vital role of blood cells in our bodies. Blood cells are essential for life. They transport oxygen, they fight infection, they help with clotting. Red blood cells carry oxygen from the lungs to the rest of the body. White blood cells fight infection and disease. Platelets help stop bleeding. The body constantly produces new blood cells in the bone marrow. This process is tightly regulated to ensure a healthy balance. Disruptions in this balance can lead to various health issues. Understanding the normal function of blood cells is crucial for comprehending the impact of blood cancer. Blood cancers impact disrupting normal blood cell function. Blood cancers disrupt the normal production of blood cells. This disruption leads to an overproduction of abnormal cells. These abnormal cells cannot function properly. In leukemia, the bone marrow produces too many abnormal white blood cells. These cells crowd out the healthy cells. This makes it difficult for the body to fight infections. Lymphoma affects the lymphocytes. Lymphocytes are a type of white blood cell. This can lead to a weakened immune system. Myeloma affects the plasma cells. Plasma cells are responsible for producing antibodies. This can lead to a weakened immune system and an increased risk of infections. Section 5. Recognizing the signs, common symptoms of blood cancer. Blood cancer, also known as hematologic cancer, can present itself in various ways, making it crucial to be aware of the signs. The symptoms of blood cancer can vary widely among individuals. They depend on the type of cancer, such as leukemia, lymphoma, or myeloma, and the stage of the disease. Some people may not experience any symptoms in the early stages, making early detection challenging. Common symptoms include persistent fatigue, weakness, and shortness of breath. These symptoms are often due to a lack of red blood cells, which are essential for carrying oxygen throughout the body. Red blood cells play a vital role in oxygen transport, ensuring that all tissues receive the oxygen they need to function properly. Other symptoms include frequent infections, which occur because the body lacks healthy white blood cells to fight off pathogens. Fever, chills, and night sweats are common as the body tries to combat infections. These symptoms are due to a lack of healthy white blood cells, which are crucial for the immune response. White blood cells are the body's primary defense against infection. Easy bruising or bleeding, swollen lymph nodes, and bone pain are also potential signs of blood cancer. These symptoms occur because the cancer cells interfere with the normal production and function of blood cells. It's important to note that these symptoms can also be caused by other conditions, so it's essential to consult a healthcare professional for an accurate diagnosis and appropriate treatment. Section 6. The importance of early detection consulting a healthcare professional. If you experience any of the symptoms of blood cancer, it is important to see a doctor immediately. Early diagnosis and treatment are crucial for improving outcomes. A doctor will perform a physical exam and order blood tests. Blood tests can detect abnormalities in blood cell counts. A bone marrow biopsy may be necessary to confirm the diagnosis. This procedure involves taking a small sample of bone marrow for examination under a microscope. Treatment options vary depending on the type and stage of the cancer. They may include chemotherapy, radiation therapy, and stem cell transplantation. Section 7. Fueling the fight. Beneficial foods for blood cancer patients. A healthy diet is important for everyone. It is even more crucial for people with blood cancer. A balanced diet can help support the immune system. It can also help manage treatment side effects. Focus on consuming a variety of nutrient-rich foods. These foods include fruits, vegetables, whole grains, and lean proteins. Fruits and vegetables are packed with antioxidants. Antioxidants protect cells from damage. Whole grains provide fiber. Fiber helps regulate digestion and can help prevent constipation. Lean proteins are essential for building and repairing tissues. Section 8. The power of plants. Embracing a diet rich in fruits and vegetables. Fruits and vegetables are nutritional powerhouses, offering a wide range of essential nutrients. They are bursting with vitamins, minerals, and antioxidants that are crucial for maintaining good health. These nutrients play a vital role in supporting overall health, from boosting the immune system to improving digestion. They are especially important for individuals with blood cancer, as they can help strengthen the body's defenses. Aim to incorporate a colorful array of fruits and vegetables into your daily meals to ensure a variety of nutrients. Dark leafy greens like spinach and kale are excellent sources of folate and iron, which are essential for blood health. Citrus fruits such as oranges and grapefruits are rich in vitamin C, an antioxidant that supports immune function and skin health. Berries like blueberries and strawberries are packed with antioxidants that help protect cells from damage and reduce inflammation. Cruciferous vegetables, including broccoli, cauliflower, and Brussels sprouts, contain compounds that may help inhibit cancer cell growth and support detoxification. By making fruits and vegetables a staple in your diet, you can enjoy a variety of flavors and textures while promoting long-term health and well-being. Embrace the power of plants and make a positive change for your health today. Section 9. Foods to limit. Navigating dietary restrictions. While a healthy diet is encouraged, certain foods and substances should be limited or avoided by blood cancer patients. Processed foods, often high in sodium, unhealthy fats, and artificial ingredients, offer little nutritional value and can contribute to inflammation. Excessive sugar intake can suppress the immune system and promote inflammation, potentially hindering the body's ability to fight cancer cells. Red and processed meats have been linked to an increased risk of certain cancers, including blood cancers. Alcohol consumption can interfere with treatment and increase the risk of complications. It's crucial to discuss dietary restrictions with your healthcare provider to determine the best approach for your specific situation. As Section 10, Personalized Nutrition, seeking guidance from healthcare providers. It is essential to consult with a registered dietitian or healthcare professional for personalized nutrition advice. They can help create a meal plan tailored to your specific needs and preferences. They can also address any concerns or questions you may have regarding your diet. Remember that dietary needs can change throughout treatment. Regular check-ins with your healthcare team can ensure you're receiving optimal nutrition support. Open communication with your healthcare providers is vital for addressing any dietary challenges or concerns that may arise. Section 11, a beacon of hope, support, and resources for blood cancer. A blood cancer diagnosis can be overwhelming. Remember that you are not alone. Support groups and online communities offer a platform to connect with others who understand what you're going through. The Leukemia and Lymphoma Society and the American Cancer Society provide valuable information, resources, and support services. Don't hesitate to reach out to loved ones for emotional support. Focus on maintaining a positive outlook and engaging in activities that bring you joy. Advances in research and treatment continue to improve outcomes for blood cancer patients. With the right care, support, and a commitment to a healthy lifestyle, there is hope for a brighter future.